is going to be speaking on building vaccine confidence. And she is the new administrator for the new administrative director of the HPV vaccine program at St. Jude's Children's Research Hospital, which is also a very exciting program. And I'm hopeful that Andrea will tell you a little bit more about that program as well. Andrea has a wide range of community-based experience that has fueled her passion to focus on disease prevention and management within disparate communities. Realizing the importance of increasing community awareness and knowledge of devastating disease states, Andrea has focused on finding and learning new facts, ideas, and translational concepts that support healthy community behavior change. And I was honored to hear Andrea speak last Friday. She presented on this same topic to our state legislators, and it is a fabulous presentation. So I can't wait for you all to hear it. And with that, I will pass the mic to Andrea.
Thank you for those very kind words, Dee. You are going to get the award for my #1 fan today, so I appreciate that. And I just want to say good evening to everyone, and thank you so very much for having me to participate in this discussion tonight. My work for many years has centered around reducing the burden of HIV in communities for St. Jude's infectious disease department, and when COVID entered our pathway, our focus quickly shifted to address COVID-19. We specifically looked at addressing community stakeholder needs and partner agency concerns that prohibited the potential for vaccine uptake. And we all likely feel, and the science is showing us as well, that the COVID-19 vaccine brings the promise of a global rescue from the coronavirus pandemic. And however, building people's confidence in these new vaccines seems to be a huge undertaking. Myths and misinformation are arising online through social media, and there are contextual factors and also oral traditions that are passed along from generation to generation that keeps an individual from trusting medical systems of care and treatment. And I'll get into my discussion points in just a second, but before I get started, I wanted to just pause for a second to share a little bit about of information about our new program that I'm part of, the St. Jude HPV Cancer Prevention Program. I think this is going into my second week, or maybe it's third. Everything is like one long day in the world of COVID, but I'll acclimate soon. And I just want to emphasize that with the HPV Cancer Prevention Program, we want to emphasize our desire to collaborate with people and organizations to increase HPV vaccination and to decrease HPV-related cancers. Our program is under direction of Dr. Heather Brandt, and she is on this call tonight. And she comes with a wealth of knowledge, energy, and experience in HPV cancer research. Hopefully my computer is going to work for you all. Let's see. The goal of our newly created program is to reduce HPV-associated cancer deaths locally, regionally, and nationally. We are addressing questions such as how can our program galvanize existing successful efforts, and how can the program contribute to emergent efforts? And we also recognize that one of these spaces is the COVID-19, what's happening around COVID-19 to help mitigate the spread of it and helping to get back on track with childhood vaccinations and not lose those credible gains. We are establishing a structure for our team, and we now have a total of 5 team members and plans to onboard another one at the end of this month. We will be working on a strategic plan to guide our program's growth and development. So stay tuned for more information to come on the HPV Cancer Prevention Program, and feel free to look over our program information at www.stjude.org. And if you would like to collaborate, you can direct a message me during this talk or Dr. Brandt, or simply contact us from the content that's on the website, and that website is right there on the screen. We're all pretty familiar with COVID-19 data and just how overwhelming the diagnosis and fatalities have been for not just our country, but for the world. And so I won't share data slides reminding us of the total numbers of individuals that have been infected and those who have passed away. But I wanted to start by setting the context just a little bit of where people stand and their willingness to accept a COVID-19 vaccine. Some individuals have pondered and asked, why is a vaccine for COVID-19 needed? And what we know is that COVID is caused by a highly infectious virus. Sheltering at home has worked, but it cannot be sustained. Masks and physical or social distancing and hand hygiene are working, but are also very difficult to sustain. And an effective vaccine can dramatically reduce infections and potentially allow normalization in society once again. And historically, vaccines have been found to be safe and effective, but there is still lots of hesitancy that exists. And this slide is from a survey that was conducted by the Kaiser Family Foundation that assesses an individual's readiness to take the COVID-19 vaccine. There was a large percentage of those surveys that were indeed ready to roll up their sleeves and get a vaccine as soon as possible. But at the very end of the chart, you will see there are some differences in African Americans and Hispanics that were surveyed compared to their white counterparts. Of the African Americans surveyed, almost 2/3 were vaccine hesitant, and about 50% of the Hispanics were vaccine hesitant, which certainly presents some challenges. And this is where most of the efforts are needed. There is some good news, however, when you see that there is an uptick in those that are less hesitant going from the time frame of September to December, and how this has really changed, and likely a reflection of all the work that has been done to get the knowledge and education to those that need it the most. And having forums such as this and other mass media campaigns have consistently contributed in a nice way. And if we want to fully achieve that 80 to 90% vaccination goals, we should continue to do as much as we can to understand these communities and what barriers actually exist, and come up with different strategies and interventions to counteract those. Vaccine hesitancy is very common, but it is also a continuum. Acceptance occurs on a continuum of levels of vaccine confidence and acceptance. Refusing all vaccines is on one end, and accepting vaccines on time or as recommended is on the other. Somewhere in the middle emerges hesitancy or reluctance or refusal to vaccinate despite availability and access to vaccines. In simple terms, vaccine hesitancy leads to refusing some vaccines, delaying some vaccines, and accepting some vaccines. For those who experience vaccine hesitancy, working to build confidence in vaccines is paramount. Vaccine hesitancy threatens to reverse any progress that has been made over the years in tackling vaccine-preventable diseases. In fact, the World Health Organization named vaccine hesitancy as one of the world's top 10 global health threats in 2019. And so we see this as a unique opportunity to produce strategic steps to help increase the vaccine confidence that's needed to help us move to the other side of the COVID-19 trajectory. Some prominent challenges that have emerged as factors that diminish vaccine confidence centers around access to the vaccines and also an individual's awareness of the vaccine and the virus itself, where they fall along the continuum of willingness and acceptance. Individuals have valid questions and concerns about the benefits of the vaccine, about the safety of the vaccine, and as well as the side effects of the vaccines. There are concerns about the speed of development and also the vaccine and its diverse representation to create the vaccine, and those individuals who affirm it and those who are recommending it. One must also be aware of the distrust in political and economic motivations that are quite prevalent, and some of the apprehension is fueled by very convincing conspiracy theories about vaccines and as well as COVID-19. And I'm sure many of us on this call tonight have read, have seen, have come across many of those conspiracy theories, and some of them are very interesting, and some of them have certainly made my eyebrows go up a little bit, and I'm sure you feel the same way. Nonetheless, they still influence how individuals approach whether or not they will take a vaccine. There are some proven strategies that have contributed to improving vaccine confidence. Our work has taught us that to build confidence, there is a need to have trusted messengers who delivers what message is important, such as those healthcare providers. They have historically been the most trustworthy source of vaccination information for parents and even for those who believe vaccines are unsafe. We also know that education is also an important aspect of this process, sharing the vaccine development process, the research approval process, what a virus looks like, and how the vaccine is structured to attack the virus and teach the body to protect itself are all important tools to help increase vaccine confidence. It is also important to assess the 3 C's, a community's vaccine confidence, going back to safety and trust in how efficacious it is, whether or not complacency plays a role in it, whether this is low perceived risk of vaccine preventable diseases, and so sorry about that. Not sure what happened, but the 3rd C, convenience. To what degree of comfort or conveniences, whether the time and the place of the vaccine being available, or just will that affect uptake? And then there are the misconceptions and the myths, and this is particularly relevant for COVID-19 vaccines. Disease risk may not outweigh fears about vaccines. Okay, so what do I mean about trusted messengers? A major component of building vaccine confidence is related to trusted messengers. Those who share the information and through which channels they share it is also very important. There is value in counting on trusted voices and trusted messengers in the community, such as those doctors and nurses and pharmacists and other healthcare professionals. There's also value in those who are of the clergy family or other faith-based leaders and trusted individuals in organizations in the community. They are just as vital in spreading the message. And during the COVID pandemic, we have seen various takes on messaging, including this example I'm sharing here for the St. Jude Cover for the Kids campaign to promote wearing masks. This is our president, Dr. James Downing, right in the center, and then in the upper right corner is one of our clinicians. You may also see in the top left a snapshot of local clergy that recorded a unity message encouraging social distancing and discouraging large congregate gatherings and the importance of, and focusing on the importance of hand washing and wearing a mask. And finally, in the lower bottom, you see Dr. James Hildreth, who is the president and CEO of Meharry Medical College in Nashville, who was, as of today, also appointed to the Biden-Harris administration COVID-19 Health Equity Task Force. And Dr. Hildreth has served as the state of Tennessee's Dr. Fauci, in a sense. Community members trust his knowledge and leadership, and he committed his time and energy to speak to community members to address vaccine hesitancy and also to demystify receipt of the vaccine. With a focus on equity and inclusion, the concept of a trusted messenger cannot be overstated, especially in terms of overcoming vaccine hesitancy. Different stakeholders have different needs for information and interventions, and our approaches to building vaccine confidence must be culturally, linguistically, and regionally or contextually relevant. And just to sum this all up, the context really does matter. Who shares what with whom and how it's shared is just very important for implementation. Many states and local jurisdictions have used gatekeepers and what speaks to their community members to draw attention to matters as wearing the mask and taking the vaccine. And this slide is from our neighbors in New Orleans that centered media around Mardi Gras season and the very famous second line dancing that they are known for. They have fully digested that trusted gatekeepers in the community are respected and revered as great messengers to help people digest these new behaviors. And if you click on this link, I'm sure we're going to share the slide, or if Emily could share it for us, you can watch the video of that campaign. It's very fun. It gets you involved. And the COVID-19 pandemic has significantly stressed public health systems around the world and exposed the gaps in healthcare for underserved and vulnerable populations. Public health system preparedness is paramount for protecting the health of all. And in the United States, COVID-19, as we know, has taken a greater toll on African Americans, individuals in our Latinx community, as well as American Indians and Alaska Native communities, which account for over half of all reported cases in the United States. The SEAL Alliance focuses on addressing misinformation around COVID-19, engaging trusting partners and messengers in the delivery of accurate information, and educating communities on the importance of inclusion and clinical research to overcome COVID-19, and most importantly, health disparities. The director of this program for the state of Tennessee is Dr. Paul Juarez, and he is located at Meharry Medical. And he has convened a group or consortium of institutions and people across the state, from UT Medical, University of Memphis School of Public Health, St. Jude, Vanderbilt, and other federally qualified health centers that are centrally located across the state in the various regions of the state, and other community members with the sole purpose of trying to reduce the impact of COVID-19 in disparate communities. There are lots of community partners that are working to improve our local outcomes, and this project is a very well-respected project that is growing and doing great things. Part of also strengthening education is sharing all information to help individuals make an informed decision. We know vaccine intention is shaped by knowledge, by attitudes and beliefs, as well as components of access. We have consistently seen increased confidence in vaccinations as vaccines rolled out following emergency use authorization. Confidence has continued to build as more people are vaccinated, and how we communicate about any side effects, if any. That means how the immune system is working, and who communicates this information also matters. And we cannot overlook the overwhelming amount of myths and misconception. There already have been reports of this uneven rollout of vaccines across the state, which is to be expected when such a process falls under the state control, and different setups in each state exist in the absence of federal coordination. However, equity and inclusion must remain a cornerstone of vaccination systems to ensure those most at risk are protected. There should be, and there has been, some transparency in reporting who is vaccinated, and just to ensure complete data for such reporting. And this also entails examining the structural roles of racism and exclusion in such systems that are expected to perform under a guise of equitable distribution. When differences are observed, understanding why they exist and acting to remedy should be a top priority. Years of mistrust and maltreatment have understandably resulted in concerns, and working to establish and build on and sustain work with trusted partners in this space is very important, and will certainly be a value add for increasing vaccine confidence. And finally, I just want to bring home that building vaccine confidence requires a multi-level approach through working with policymakers and health workers and the public health workforce and media and governments, among other key stakeholders. A one-size-fits-all approach just simply will not do well with all communities. We must begin by listening to community needs and concerns, and consider that needs should be tailored to the individual or targeted, contextualized to the community. no single intervention strategy addresses all instances of vaccine hesitancy, but through collaborations and wonderful seminars like the one that we're having tonight, we can effectively make a difference in where someone falls along the continuum, confidence continuum, and help them to fully achieve the end goal of developing and accepting the best approaches and leveraging to build confidence in vaccines. And that really concludes my conversation tonight. And I just want to thank you for allowing me to share. And I do hope that this was informative for you. And I want to acknowledge our awesome HPV Cancer Prevention Program team members, all who have tuned in for tonight's call, and they are on the ready to hear from any of you that are willing to partner with us as we work to increase HPV vaccine uptake and reduce HPV-related cancers. And I just want to thank you all again for having me.
Andrea, thank you so much. I enjoyed that just as much the second time as I did the first time. And I know our group did too. So does anybody have any questions for Andrea? Feel free to type it in the chat.
I think there are a couple of comments in the chat. Is there a possibility to send this out to the group so that they could have that presentation? That was one of the questions.
Yes, we can do that.
Fantastic.
I will also, as long as it's okay with Andrea, this will be that section of our meeting, that video section of our meeting will be posted on the new website along with the slides, if that's okay.
Thank you. Does anybody have any questions? I didn't see that chat. That chat wasn't coming up for me, Michael. So let me know if you see anything else in the chat too. Oh, Doug wanted to know, do you have any examples of culturally focused outreach that has been successful?
Well, of course, you know, this world is new for COVID-19, but I can tell you we started to do conversations just really trying to improve the knowledge base for those individuals that were most impacted by COVID-19. And that started somewhere in September. And we absolutely did not have a messenger that fit into the demographic of the individuals we were trying to engage with. So we worked alongside Church Health Center in Memphis, Tennessee, to start with clergy, because we knew that we understand that the faith-based institutions in Memphis are the nucleus of many African-American households, as well as our Latinx communities. And so we worked with Dr. Scott Morris to sort of bring together this cadre of clergymen so that we could talk about COVID vaccines, the studies that were happening, and we immediately received pushback from those who were in minority groups saying that the messengers, they wanted to see people that looked like them deliver the message. They wanted to be able to ask questions from people who they knew and they trusted. And so we had to go back to the drawing board and find the right to really meet that for them. And once we brought in Dr. Hildreth to address them again, it was the same exact message, but it was the delivery and it was the individual who could relate to the social issues that were happening. From there, my phone would not stop ringing to coordinate and to set up and to get access to the congregations of all of those churches that were on that call. So not necessarily a proven evidence-based strategy that has gone through some rigor of testing, but we certainly received lots of feedback, lots of comments, lots of requests to then have access. So Dr. Hildreth was able to help us get access. He served as that trusted gatekeeper, that stakeholder for those clergymen. And so we began to get more calls from those who were in the minority community that helped to sort of spread this word to the congregations. And the calls are still coming almost every week. And so I think that is really, that speaks volumes to having trusted gatekeepers to really deliver the message so that it just affirms that that trust is there and that maybe this is not politically motivated and this is not motivated by financial gain, but this is really something that we should all be tuned into so that our community can become more healthy.
Thank you so much, Andrea. And Heather Brandt has put in the chat also a link to a candid conversation on COVID that's coming up tomorrow by United Way, or that United Way is hosting. And there's a link there for you all in West Tennessee. So please don't miss that. I love sharing that kind of information. We had a Nashville Health had a very, very good discussion with Lisa Piercy and Metro Nashville Public Health Director. And so, yeah, those talks are super, super helpful for your areas. Any other questions? Andrea, thank you again so much. We're just honored to have you and love learning more about your program too. Heather, did you want to just say a word so people can see who put your name and face together?
Sure. Thanks so much, Dee, and great presentation again, Andrea. And I guess I'm going to make a very intentional link to the hesitancy that we're seeing with COVID-19 vaccination is, of course, not foreign to those of us who've worked in HPV vaccination specifically. And in fact, a study just came out yesterday in the journal Pediatrics that showed hesitancy among parents regarding HPV vaccination is increasing. So I think that while the COVID vaccine approaches may be building on previous vaccination campaigns and the like, that in the HPV world, we have a lot to learn from how they are engaging trusted messengers and really thinking about how that can serve as a catalyst to help us overcome some hesitancy as well. And I also want to echo Andrea's invitation for those of you with whom we haven't had a chance to meet or work with in some way. Please reach out to us. Carol Miner and Julia Neely are also on tonight, and we really look forward to continuing to work with Immunize Tennessee and all of the other great partners who are part of this organization and the work in the state. Thank you.
Thank you, Heather. It has been a delight. We've already started doing some work with Heather and her group, and it's just been nothing but positive and very, very exciting what she's doing there at St. Jude. So thank you, Heather.